Hi, I'm Marci Javril with Yoga of Touch. And today I'd love to share with you a presentation that I gave for a team of surgeons, but it does apply to anyone who's had surgery anywhere on their body, as well as if they've had an illness or an injury. So let's take a look at the science behind the art of my rejuvenation methods. It's all in my book, Feel Like Yourself Again. And we're focused today on a chapter that I have all about post-surgical recovery. And it does give you hands-on instructions on how to improve your long-term results. And I know you're going to be interested in this, even if it doesn't apply to you. Perhaps it applies to a loved one, a client, or someone else you know. So please take a moment, it's only 20 minutes, and absorb what you can, and go home with the idea that you can improve your long-term results simply by learning a few easy hands-on methods that will accelerate recovery. Feel better faster. Stay stronger longer. Yes, you can. Hi, my name is Marci Javril, and I'm so happy to be here and give you a chance to see all the work that I've been developing over 30 plus years in my career as a massage therapist. I have had the fortune to work with some of the top surgeons and doctors in Los Angeles, and I've been teaching at many schools over the years. I've written a book, I've created protocols. I'm in private practice right now, not affiliated with anyone in particular, and I'm here not to go over my credentials, which you can look at in your leisure, but to tell you more about the possible negative consequences of breast cancer treatment and surgery, and how my developed melting touch method can improve your long-term results and accelerate recovery for all of your patients. I also provide a comprehensive approach to empower your patient participation. So you can see in your handout, there are my credentials, and it tells you all the ways that I've been developing this methodology. I have a YouTube channel that gives self-healing lessons and video archives from my lectures, and I love to use that to encourage my patients for their follow-up so they can participate in their own healing and feel empowered that progress is really being made. So you can see those are pretty popular ones, and I have way more than that. So I do want to say that my work is focused on lymphatic drainage. I'm sure that all of you doctors and surgeons know how extremely important the lymphatic system and immune system are, and how important it is to transport all those wastes and toxins out of the body. So I'm not going to give you a physiology lesson. I'm simply giving you some references so that you can go over the resources that I have, that I share with every one of my patients, which I consider also my student when they come in. So you'll see here a list of the contraindications, the cautionaries, the indications, and the medical disclaimer that I always give, where I also make sure that people have cleared the work with their primary care provider. My presentation is focused on the next 2 pages you'll see here. The lymphatic massage fortifies the blood and immune system through increasing cellular exchange of wastes and nutrients. I cannot stress how important this is to have as a continuing process, not just after, but during and actually before, as preventative maintenance. Because opportunistic diseases cannot have an opportunity if you are cleaning the waterways of the body. And I am a specialist in your fluid body. So here you have all about my training and the background and the guidelines that I use to help increase your circulation on a healthy lifestyle. And on the next page, you'll see that the reference is from Dr. Bruno Cicli, who is the world's leading expert on lymphatic drainage massage. And I defer to him for lymphedema treatment, which is not what I'm focused on so much as preventing lymphedema and helping those who have the possibility of fuller recovery get there more quickly, feel better faster, and stay stronger longer. So you'll see here on this list, there are warning signs for lymph imbalance before surgery occurs that you'll want to be sure your patients have these handled before they come in and start treatment if possible, or get them going as soon as chemo starts. We can do lymphatic work. We just have to wait at least 4 hours after the treatment. Radiation, we wait for, we don't do that quadrant of the body that's being radiated. So, the crux of my presentation is on this page. The symptom and issue and the methodology that I use to counteract that. Fibrocystic and density and congestion in the breasts, I use a lymphatic massage and healthy lifestyle habits. For the chemo brain and fuzzy thinking, I use OA decompression, occipital atlas decompression from craniosacral work, and what I call as a brain cleanse massage, focusing on the skull itself. Stress and anxiety. We reset the parasympathetic rhythm with relaxation and by entraining the brain with very slow, gentle, repetitive strokes. Low libido and hormone imbalance, I use abdominal massage for reproductive health. And this is amazing for people. They get in touch with all of their internal organs. And for women, I tell them it's like searching through your pocket with your eyes, your pocketbook with your eyes closed. You'll find things and just allow them. Insomnia, we activate the vagus nerve. And I encourage people to learn meditation. Fibrotic tissue formation can occur, but gentle lymph drain done as soon as possible post-operatively will prevent that from happening. The fibroblasts will not get a chance to settle in. For pain and inflammation immediately, even over a tissue or a bandage or good sutures or a piece of cloth, we can do very, very light lymphatic drainage. For swelling and pre-edema, before edema sets in, we can do lymph node pulsing and drainage of the deep passageways. If there's constipation after the anesthetic, then we reestablish the colon peristalsis with very gentle hands-on movement that matches that rhythm and helps the constipation, because we know that we do not want any kind of colon blockage. The bowel obstruction is the worst thing and is very possible as a consequence to a lot of surgeries, because we do interrupt that peristalsis. So this is really, really important. Poor digestion can occur also. So I release and drain the liver gallbladder. This is a very simple hands-on procedure that can be very gentle as well. If there's bladder incontinence, I reposition the urinary bladder. It's a simple mechanical procedure and can be done as long as there isn't any abdominal scarring. Or I wait at least 6 weeks till after any kind of bikini line incision might have been made in other parts of the surgery, or I may have to soften a bikini line incision in order to take care of bladder incontinence. If there's lung congestion, which could lead to pneumonia, I have a technique which reestablishes the pleural vacuum and the spleen drain. But the most important thing I want to talk about is the thoracic duct dysfunction, which can occur because the fascia layers have been wrinkled and moved around and perhaps adhered, and fibroblasts have occurred, and that fascia in the chest is so important and so crucial, and you'll see some illustrations later on in my handout that explain in detail why I'm so involved with thoracic inlet release, especially for all of your breast cancer people, and especially if they've had any issues in the chest previous to their treatment with you. Okay, so breathlessness. This might be due to needing a respiratory diaphragm release, and I also teach them yogic breathing. Incision keloiding, after 2 weeks, we begin progressive scar softening, and so that's a really great preventative towards that. Adhesion formation, the same thing, using myofascial release and skin rolling. This really provides the possibility that these will not occur, and if they do, they will break up and be mobilized and moved out. Any extraneous fibroblasts can be moved through the lymphatic fluid and the obligatory lymph load. If there is misshapen scarring from a biopsy or an axillary node removal, then that's possible. We can also do myofascial release to that area. Bone density issues, I teach people safe inversions, how to do weight-bearing exercises, and muscle spasm. Lymph massage moves the excess proteins, which is what's usually creating those muscle spasms. And it returns those proteins to the heart much more quickly, so that helps the whole rebuilding process. And if there is lymphedema, dry skin brushing can be done on the unbroken skin surfaces. And I always recommend compression garment protocols, and I defer to people who are lymphedema experts, because my focus is really more on what I call lymphatic clearing, which is the fluid uptake through the nodes, returning through the subclavian, but also the peristalsis of all the skin, the cerebrospinal fluid, the parasympathetic nervous system, the vagus nerve, the colon, and all the digestive functions are so important, and they're all incorporated in what I do in Melting Touch method. So, breast replacement after mastectomy, the possibilities with a saline replacement, adhesions, right? Same with silicone. Using her own fat, well, then we need to think about how the drainage pattern can go back to the watershed, to the axillary, and provide a way for that to be more reabsorbed, and slowly but surely use a progressive myofascial release and scar softening to bring that fat into harmony with the surrounding tissue. It really, I've seen some amazing cases. Using her muscle. This means there's 2 sites for the incision, where the muscle was removed and where the muscle was inserted. And I have 2 patients that have had this done very successfully. And the crux of it is to make sure that the site where the muscle was taken has as much possible recovery as you can give it, and make sure that all the lymph node removals have a pathway then for the real lymph to move to functioning lymph nodes, and that way the fluid doesn't build up. If there's no augmentation, then this gentle lymph drainage to the thoracic watershed, myofascial release, and range of motion stretches are what she really needs. And I do find that when there's no augmentation, of course, the recovery is much faster. And so, often a prosthesis then can rub too harshly, and so she may not want to use that prosthesis for the first month or so as she recovers. That skin is really tender and thin often. So other surgeries, she may have a biopsy, lymph node removal, an incision or removal anywhere, or a liposuction, a tummy tuck, navel repositioning. These are all, again, surgical incisions that have consequences for lymph movement, that need to have scar softening. And also, if there have been any previous surgeries, cosmetic surgeries, heart surgeries, gallbladder removal, old cesareans, hernia surgeries, anything at all, tattoo removals, these can all, in the fascia body, interfere with the lymphatic fluid movement. And I know how to address these constraints. And so that's what we do. with the lymphatic work. I take care of all of these things through my comprehensive approach. You can see it from my book. You can get that book on Amazon, and here is the table of contents. And on this page, you'll see the quality of touch is 80% of the effort. And the rhythm and the repetition creates a full body wave. So what I do, incorporating all these things together, really put that body into its fluid state where the central nervous system and the cerebral spinal fluid and the lymphatic fluid, the digestive juices, the vagus nerves, everything is moving in harmony. And the parasympathetic is coming back into place. This really takes care of insomnia and anxiety. So important. And the punchline is that I teach this modality to my patients who become my students. And this is where we get all the benefit. So again, a few pages from the book that's been published. And these are just references. I know you know your anatomy, but guess what? The old anatomy has been changed. In June of 2015, we had a new discovery in the brain. So in the dura mater of the brain, we found another duct. And guess what? I've been teaching about how the head connects to the gut for many, many years. So here's a chart of how I show that in my book. And my teacher, Lauren Berry, was correct. The lymphatic meningeal vessel connects to the subclavian and the thoracic duct. And I'm telling you, the debris, the semi-solid debris that needs to go to the colon needs to go through this duct. So here's more examples of how that respiratory diaphragm and the lymphatic duct in the thoracic area need to be in harmony. And I have discovered that the myofascial release system that John Barnes teaches in the upledger system of releasing all of the horizontal diaphragms is extremely important to the lymphatic flow and the fascia. So again, from Anatomy Coloring Book, you'll remember the abdominal cavities and how there's a vacuum that connects them all. My teacher, Lauren Berry, taught me how to reestablish that neural vacuum, that pleural vacuum, and help augment the flow of semi-solids to the colon. I know this for a fact because I've worked with a lot of colon hydrotherapists. So, more for your reference. The anatomy trains are now what we see as how to approach the body in its most complete harmony. Not the muscles and bones, but the fascia. So again, for your reference, Tom Myers has written an amazing book, and you can see the fascia of the chest is where I'm focused on for our breast cancer survivors. So the alimentary canal interacts with the respiratory diaphragm, and in the work that I've learned, it's called the Thoracic Inlet release. Extremely important. Hasn't been addressed, needs to be noticed, and it also goes along with a respiratory diaphragm release, which you probably already know, but I know how to do this in a very gentle way. So quickly, again, an illustration from my book. And in my book, you'll see a reprint of the article that I wrote in 1989 with a surgeon who no longer works here in Beverly Hills, but she did work with a surgeon we know well here, Brian Novak. And you can see more about my work in the 80s with her and Brian. And that's where I learned so many of the things that I then put in place, taught in schools, and used on hundreds of clients. So here again is a page from my book showing you the progressive scar softening treatments that I performed on somebody who had a bikini line incision after a hysterectomy. Here's the homework that I always gave out to my post-op patients when I was seeing them, or something for abdominal surgery, so that's why it's all focused on the belly. And one more time I want to mention that in lymphatic drainage circulation, we have 3/4 of the body draining towards the left subclavian and 1/4 of the body towards the right subclavian. So the consequence of having any kind of surgery on the left side is accentuates this sluggishness that might occur on the left side. And so I'm extremely focused on making sure that left side clears, and that I make sure that the back of the left rib cage, which is the back of the left breast, especially if she's had the left breast removed, that is a very important area. The watersheds change. The body is so intelligent that the lymphatic capillaries can change when there are no lymph nodes available to filter the circulation. Those little epithelial cells, one epithelial cell wide capillaries, know how to reform and change themselves. They can be encouraged with manual palpation, strokes, rippling, stretching of the skin. Here's the mapping that Dr. Chickley talks about in his book. And here's the bibliography and trainings that I have had in my lifelong work as a massage therapist. And I thank you so much for your time. That has been 20 minutes. And so I guess that I don't have time for questions, but you can email me or call me or come to my website. And I'm so happy that I got a chance to introduce you to this comprehensive approach for better results and improving your success rate with all of your post-surgical clients, your post-cancer treatments, and potentially preventing more people from needing those treatments in the first place. Thank you. Marci Javril.